So critical and comparative analysis of ethics, group activity, and then my name is Siglali.
I'm Abby.
I'm Ava.
I'm Sherry.
I'm Patience.
Perfect. So provision 2, I have a brief summary. So a nurse's primary commitment is to the patient or group receiving care, placing patients' dignity, rights, and values over any other interests. Nurses help assist patients in making informed decisions about their care, and when appropriate, they assist resolving conflicts between their patients' wishes and the demands of others, all while advocating for treatment consistent with patient needs. And provision 7 summary is, so nurses must contribute to the development of the profession through research and knowledge development, ethical standards, and active involvement in shaping nursing, health, and social policies. Through these efforts, nurses strengthen evidence-based practices, advocating for equity and ensuring that nursing remains responsive to the evolving needs of society and healthcare. So the first question is, what ethical theories or principles is this provision designed to uphold? So provision 2 supports beneficence, non-maleficence, fidelity, and respect for autonomy. Provision 7 supports justice, beneficence, and accountability. Provision 2 is more focused on following moral rules, while provision 7 is more outcome-based focused. And a nurse has a moral duty to not only advance patient care, but also to the professional progression of the field.
And then what virtues does this provision exemplify? I said provision 2 is all about putting the patient first, no matter if they're an individual, a family, a group, or even an entire community. As a nurse, our main responsibility is to make sure the patient's needs come before anything else. This means listening to them, advocating for them, and making decisions that protect their well-being. It also calls for qualities like patience, compassion, honesty, courage, and strong nursing skills. And then Provision 7 focuses on helping the nursing profession grow and improve. This can be through research, developing better nursing standards, or influencing health policies that benefit patients. And then the same values of knowledge, skill, wisdom, patience, and compassion are applied here, but the goal is to make a bigger impact on healthcare as a whole.
So contrast the provision with the code. This provision meaning the second and the seventh one with the code of ethics from another disciplinary place. I chose to do pharmacy, and while nursing is commitment to receiving nursing care such as patient and community, the advocate and dignity is one of the most important like parts. But for when it comes to pharmacy, the primary obligation is for the individual patient and their well-being, and emphasis on the autonomy, dignity, and confidentiality. I don't know. I can't say the word. Confidentiality. And then the contrast for these two is basically having have a patient first focus, but when it comes to nursing in a way, it's put it into like a little broad and like a broad holistic responsibility. I think about it in a way like if this is like an example for me to like help me understand it was think of pharmacy like a master chef who like follows like the perfect recipe and everything. But for a nurse, like they follow that, but they try to also add ingredients to like when they're adding it, it's like looking at a person as a whole. Like we're told to look at a person as a whole, like who they are, their beliefs and all that. But when it comes to a pharmacy, you're just specifically focused on that person and nothing else besides that. And then when it comes to provision 7, advancing the profession, nursing does require advancement of the profession through things like research, policy work, and scholarly inquiry and setting professional standards. While for pharmacy, it highlights and makes and emphasizing maintaining competence, integrity, properly serving the community, and making sure that fair fair resource distribution. And when I read the part about the fair distribution, there was this article I once read that I did I don't know if this is like a good connection, but I seen it where they had like people of color and non-people of color. They would give them different medication if you're a person of color, but if you weren't a person of color, they would give you like a different medication. And there was like a lot of research done, and that they basically do have a policy where everybody has to receive the same medication, no matter like where like who you are, your skin color. So I thought that was pretty cool to know.
So it's what similarities and differences do you find? That one?
Yes.
Yeah.
Okay. The similarities, both the ANA Code of Ethics for nurses and the NASW Code of Ethics for social workers uphold core virtues such as compassion, advocacy, integrity, and respect for autonomy, ensuring that professional actions are grounded in moral values. Both codes stress a commitment to client welfare, prioritizing the dignity, safety, and rights of individuals regardless of background or circumstance. Each code emphasizes the professional responsibility to serve not only individual clients, but also broader communities, advocating for systemic improvements and equitable access to services. Both professions value collaborative interprofessional approaches that integrate evidence-based practice with ethical decision-making. And then the differences, provision 2 versus social work, the nursing code emphasizes clinical excellence, evidence-based care, and active participation in healthcare research, policy leadership, and a clinical decision-making to advance patient outcomes. In contrast, the social work code places greater focus on advocacy for vulnerable populations, addressing socioeconomic and cultural barriers to care and influencing policies that impact marginalized groups. Provision 7, nursing versus social work. Provision 7 of the nursing code encourages nurses to engage in research, professional development, and the advancement of healthcare practice, whereas the social work code gives stronger emphasis to social justice, structural advocacy, and dismantling systemic oppression. This includes tackling inequality in areas such as housing, education, and healthcare access. While nurses' ethical framework is more healthcare and treatment-centered, social work framework is societal change-centered, aiming to address the root causes of inequalities alongside providing direct support.
Okay, and then I had look into the future 15 years. Based on expected advances in healthcare, what revisions would you expect would be needed in this provision? So for provision 2, it's the one with the nurse's primary commitment to the recipients of the care. A lot of the like research that I saw was like it's moving towards more like telehealth appointments and using AI and like medical stuff. And a lot of the patient's medical history is like either on an app or like a portal. So I think a change would just be to make sure for provision 2 that we're protecting the patient's privacy and making sure that we're still committing time to the actual patient, and communicating with the actual patient instead of, communicating through an app or like a portal or all that kind of stuff. And then for provision 7, which is the advancement of the profession. Um, One article that I found says that um, uh, it talked about how we as nurses can what is it called? Sorry, I just like lost my train of thought. We as nurses can um, get a higher education. We can do like online school to become like a nurse practitioner, or there's like a bunch of online programs that you can do. So I think that should also be a change that could be made, is like accepting more and more of those like online programs just because it's more feasible for people to do things online, especially if you have like a family or kids or anything like that. Um, And then this would also be benefit to patient because then we all get to get the training and the best care available, and be able to give that to our patients. And then that way, the healthcare team is properly trained, and this will be helpful since the medical world is always changing.